offering Microsoft Teams, Dynamics 365, and Power Apps platform solutions designed to accelerate employee productivity. More information at aerieconsulting.com.
This is Charlotte Talks. I'm Mike Collins. The fact that homelessness in Charlotte seems ever present is not because the problem is being ignored. On the contrary, over the last decade, this community has made significant investments to prevent homelessness, to provide shelter for those who find themselves homeless, and to find or create permanent, affordable, or workforce housing. Still, the problem persists. Last July, more than 3,000 people were homeless here. 10,000 more were at risk of eviction. And again, efforts are underway to address the need. The Charlotte Mecklenburg Housing and Homelessness Strategy Working Group has released the results of their investigation into the problem with some suggested solutions. In this hour, we will take a closer look. We're joined by three members of the Housing and Homelessness Strategy Working Group. Stacy Lowry is Director of Community Support Services for Mecklenburg County. Welcome back to the program. Nice to see you. Good morning. James Lee is here. He's an affordable housing advocate at the Stan Greenspon Holocaust and Social Justice Education Center. Thank you for joining us again.
Good morning, Mike.
Morning. And Liz Clayson Kelly is back. She is CEO of Roof Above, an interfaith organization dedicated to ending homelessness. Good to see you, Liz. Nice to have you here.
Good morning.
Stacey, let me start with you because this study, the 2025 Charlotte Mecklenburg Housing and Homelessness Strategic Framework, it's a mouthful, purports to be the first, quote, comprehensive effort to address housing instability and homelessness in Charlotte involving the public, private, and nonprofit sectors. Really? We've been dealing with this and raising money for this piecemeal with no coordinated strategy all this time?
I think what we've found is that we have done a really good job of looking at specific problems. And this time, what we've actually done is created that first community strategy that addresses the full continuum from housing instability all the way to homelessness. Prior, we focused just on homelessness, just on chronically homeless, homeless veterans. And we learned that in order to move us forward, you can't just look at the one problem. You also have to look at some of the solutions as well as prevention. So what's unique about this strategy is it's comprehensive, which is what you said. It's looking at that full continuum and not just on the problem of homelessness, but also housing instability and the need for affordable housing.
Let me read something else from this report. It says that, quote, over the past 2 decades, Charlotte Mecklenburg has addressed chronic and veteran homelessness, created a centralized and streamlined intake process for anyone seeking housing assistance, reconstituted the continuum of care. We can talk about what that might mean. And over the last several years, focused upstream on homelessness prevention. And yet, it says, these efforts have only impacted parts of the overall issue. Is that what led this work group to come together and to create this plan? Is that why this is coming out now?
Yes, I would say that that is one of the reasons, along with the impact of COVID-19. The impact of COVID-19 on homelessness, it didn't start the problem, it's always been there, but it became front and center in Charlotte Mecklenburg at that time. So with the visibility, along with knowing that we needed to be more strategic, is why we came together to do better, because Charlotte Mecklenburg can do better, and I think we all know it.
James, when they put this study and this report together, they wanted to make sure that they had people from different backgrounds on the what I think is a relatively large group of people who worked on this over the last several months. They wanted to make sure that they had people who understood homelessness, and in many cases who have lived through it, and you have. You were homeless for nearly a year at one point. How did that experience inform your approach to being on this committee that put together this report?
Thank you, Mike, for the question. Let me preface my comments by saying thank you to Gene Woods and Kathy Besant for bringing us together, because truly we live in they call it the tale of two cities, right? And during my experience of being homelessness, I saw that second Charlotte. And I think what makes this different is that these two Charlottes have come together. And we've had some really serious conversations about what that means to help folks like myself, whatever it is that they're dealing with, mental health, substance abuse, disabilities, whatever that is, and putting in place the things that can help you to succeed and sustain where you are. But I've been on a lot of conversations, and I'm appreciative of the effort, and I'm very optimistic about where we're going.
Well, quite often these committees who are trying to do good in the community do it from the top down, from the 30,000-foot view. And when they involve people who have lived through it, it seems to me that they are bringing people into the conversation that really know what they're talking about. So were you the lone wolf on this committee, or were there others like you who had either participated in homelessness or other aspects of this?
I was not the only one. Deborah Denise, James Searcy, a couple of that come to mind. I wasn't the only one with lived experience, a part of the working group. Even some of the other ones who you think didn't have any lived experience had lived experience. So I think we have voices, and it's a high level document, but there's a lot of the hidden, invisible Charlotte in the document. There's a lot of knowledge that came from us to help the situation. Whether people listen to us, that's going to be the next step.
You referenced and thanked Kathy Besant and Gene Woods, who are the co-chairs of this effort. And Kathy's with Bank of America, and Gene Woods is the CEO of Atrium Health. They are as far away from homelessness as a human being can get. So when you're in a group of people like that, and you're bringing your personal experience to a task force, looking at the problem, trying to come up with solutions to the problem, what did you and others who have lived through this say to those folks that may have given them an eye-opening experience?
I think in one conversation we were having with Kathy, I think she was almost brought to tears in the conversation of where the conversation was going, right? And that showed me that even though they're busy, both of them, I mean, they got a lot on their plate. I think they understand, and I think we were able to bring out some of those elements that like people don't really talk about. So where I am, I'm not afraid to say anything that's going to help my community, because I want to help Charlotte become #1 up mobility. That's my mission.
Let me ask you, Liz, because you're on the front lines of this with the room above, and you deal with homeless folks all the time, but you are still once removed from the situation. From your point of view, what did including previously homeless people on this committee bring to this report?
Yeah, well, I'm so grateful for James Lee and others who were part of the working group. And I mean, we did all this planning virtually because of COVID, right? And it could be an intimidating atmosphere. You've got a lot of people and when to speak up, and really appreciate the rootedness that James and other voices the table in terms of both the urgency as well as what are the solutions. We also, though, had 12 focus groups with people experiencing homelessness or coming out of homelessness. I know I led the temporary shelter work group, and we prioritized all of our, we said, what do we think is right? And then we took it out to these 12 focus groups and said, you help inform us, because if you're not designing with the people having the experience, you're not going to have a good solution at the end of it, right? It's critical that we take wisdom in all the places it comes, right? And so that included lived experience, that included data, that included best practices from other cities. But it does take courage. And so I'm so grateful for the voices who are willing to be in the room and speak up, and the plan is much better because of it.
This report reiterates something we already know, and that is the intractability of this problem. It states that despite all of our best efforts, quote, housing instability and homelessness are an ever-present problem for our residents in Mecklenburg. And we're going to get to some of the solutions as we go through the program that this report suggests. But in a city, a growing city, where housing is scarce and the price for it is rising daily, where rents are rising and the cost of rent appears to be perpetually escalating to the point where even relatively well-off people can't afford rents in this city, and in a city in which that's in a state where the legislature gives municipalities no tools whatsoever to encourage or incentivize or mandate, that's the better word, that affordable housing be included in new projects, et cetera. James, can we ever really solve this problem?
I believe we can, but it's going to take some outside the box thinking. It's going to take some money. It's going to take people not throwing the hot potato around. Somebody's going to have to take the authority of this. I prayed all weekend about this conversation, and one word kept coming up. That's intentional, right? We've had these reports that have the best of intentions, but the word intentional means that you're doing something with a purpose. You're doing something that's deliberate. You're choosing to make these decisions, and then with that, not only that, you're going to take action. And so we've had a lot of best of intentions, but I think this plan, because we've had the group, this is very intentional in what we're going to be doing, I believe, and we just have to keep our foot to the pedal of the voices of the people that we serve in the forefront.
Stacey, if you agree with that, does that say that the other plans, and there have been several others, and we'll talk about those too, were unintentional, or that they did not have the same kind of thrust that this new plan has?
Yeah, I would agree with James. First and foremost, I think we can do this. And I think that what we have now is we have a comprehensive framework to really look at and I kind of look at the framework as providing a ray of hope for this insurmountable problem. The framework pulls all the pieces together so we can tackle that full iceberg instead of chipping away like we've been doing. And that's different. And even what James and Liz stated, the framework also reflects the voice and input of our community, which we were not intentional about in the past. In addition, it does also reflect the voice and input of other communities, because in addition to the focus groups that Liz referenced, we also had expert interviews and also interviews with peer-to-peer cities to see what works in Charlotte and what might not work in Charlotte. So I think we're in a different place today. We have the holistic, comprehensive framework so that we can now employ what we've learned over the last several plans to really make a difference.
Stacey, since you have been in conversation with other cities and other leaders in other cities, surely those cities are doing something about this problem or trying to. Have any of them succeeded to the degree that we hope to succeed?
No, just like Charlotte Mecklenburg likes to do things first, looking at this comprehensively from the entire continuum, housing instability and homelessness is new. So people have not yet done that. They've done pieces of it.
So Liz, you've been on this program many times in the past, and you're on the front lines of this problem, helping people with their homeless situation. What do you think is the major stumbling block that these folks face and that Charlotte faces in tackling this problem? And I have about 30 seconds.
Okay, 30 seconds.
And we can come back to it.
I think your lead-in question is right, Mike. You talk about we're growing, we're not building housing, rents are rising in a way wages aren't keeping up. Homelessness is a symptom of our housing situation, and that's a system issue that involves federal, state, and local policy. And so that's the challenge, is the housing world around us is changing and it's impacting human lives. And
we'll come to that. Yeah. We'll come back to that in a minute with Liz Clayson Kelly and others at Charlotte Talks on WFAE. Support for Charlotte Talks comes from WFAE members on the Spectrum Center, presenting singer Andrea Bocelli, featuring Opera Carolina Orchestra and Chorus, February the 11th. Tickets and information at Ticketmaster.com. And Atrium Health, dedicated to promoting better lives through better health with comprehensive care focused on overall wellness. Atrium Health. Coming up tomorrow on this program, it is Mayor Via Lyles with us. She's here once a month. City Council is bringing back discussions about term limits, a discussion that we've heard before. Members are talking about whether to extend terms for council from 2 to 4 years. We'll talk about that. There's an upcoming vote vote on a controversial project in Ballantyne up for rezoning, and we'll get her take on a judge giving Hidden Valley residents time to revise their redistricting suit. All that and more with Mayor Vi Lyles tomorrow on this program at 9.
I'm WFAE climate reporter David Borax. We're tracking the challenges facing Charlotte and other cities as they try to eliminate fossil fuels.
I think that the goal is an ambitious one, admittedly, and it's going to be tough to meet.
Keep up with all the latest climate news and subscribe to our weekly climate newsletter at wfae.org/climate news. Climate coverage on WFAE is supported by the One Earth and Salamander Funds.
It's Charlotte Talks on listener funded 90.7 WFAE and 90.3 WFHE. I'm Mike Collins. We're talking about the 2025 Charlotte Mecklenburg Housing and Homelessness Strategic Framework, a new report that sets out the problem and has some solutions. It's phase one of a two-phase effort, and we're talking about it with Stacey Lowry, Director of Community Services for Mecklenburg County, James Lee, an affordable housing advocate at the Stan Greenspan Holocaust and Social Justice Education Center, and Liz Clayson Kelly, CEO of Roof Above. I threw you a curve, Liz, before the break and asked you to solve the world's problems in 30 seconds. I asked you what you thought the biggest stumbling block to eliminating or reducing homelessness in Charlotte was. And what you essentially said was market conditions, market forces that keep housing costs higher than they need to be if we want to solve this problem. Is there a solution to that then?
Well, I think it's interesting. We always think about homelessness and poverty being linked, but when you look nationally at the issue of homelessness, it's the most prosperous cities where homelessness numbers are the highest. So those are the cities that have the most resources to address it, but they're also growing where you see rents rising. So it becomes really challenging, right? And so I mean, I'm a big believer that public policy, and I studied public policy, so I'm a big believer that has to be part of it. But the question is always, how do you get to those bigger public policy changes? And, part of our mission is to end homelessness one life at a time. And so it's that resistance on the front line. It's creating housing solutions, really working one life at a time, moving people. And the hope is that moves us to see these larger policy changes that we need. And I think you're right in saying Mecklenburg has fewer tools because the state legislature allows us fewer tools, but that doesn't mean we give up, because the lives we're fighting for are lives worth fighting for. And so, I think this framework goes a long way. And part of what it says is also we're going to need to be looking at state policies, maybe federal policies to address this as well.
Do we know why or understand why more successful, wealthier cities have a larger homeless problem? Is it because people come here and lose their jobs and can't afford to live here? They come here, but still can't afford to live here, even if they have a job? Or are they coming here because we have the resources to take care of them and we're kind of a place to be if you need help?
So it's a systems level. And so the most prosperous cities are where people are moving there for opportunities, people of all income levels. Housing's not keeping up, rents are rising. So it's not just prosperous cities, it's the distinction between what's your area median income and what's your rent. And the more discrepancy there is, the greater housing displacement and homelessness we see.
So the dearth of affordable housing is one part of this problem, but it's not the whole enchilada. James Lee, what should we know about, since you experienced homelessness for about 11 months, what should we know about the people that you came into contact with during that period of your life and how they found themselves in that situation?
I think the one thing that came out of that was that when I instinctively ride the bus and ride my bike all the time. So I'm amongst people who are like me. So I look at everybody like they're my brother, my sister, my aunt, my uncle, and that gives me a different baseline for a feeling, right? Because if I see somebody, an old man who, like, one day he had urinated on himself and everybody went to the back of the bus. I didn't go to the back of the bus because that man could have saved the nation. He could have been anybody. So I think once we start looking at the invisible people, which I felt like I was invisible, right? Because you feel like you're invisible when you're homeless. You're nothing. You already have no hope. But then to have people not see you, that's even a more slap in the face. So I think that one of the things that I learned is that, I want to see people. And I think that this report is going to see us and hopefully make a difference in that.
Stacy Lowry is with us from Mecklenburg County. The vision painted in this report is for Charlotte to be a community where homelessness is rare, brief, and non-recurring, and every person has access to permanent, affordable housing and the resources to sustain it. That's what the report says. You have to shoot high if you want to attain any goal in the world. But if we follow this plan and its suggested solutions to a T, will this goal be achieved?
That's a really good question. Keep in mind that the framework is the first step, and we're going to be moving into the implementation planning. And part of the implementation planning phase is where we'll be able to prioritize recommendations, as well as look at scalability, and then also the sequencing, because there are some recommendations that will require other things to occur, perhaps policy level recommendations, before we can enact them. So I think it's a really good framework to get us chipping away, and it's comprehensive. And I believe that we can make a difference one life at a time here in Charlotte and Mecklenburg using this, but it's a marathon and not a sprint.
I threw out some numbers at the very beginning of the program, but James, talk about the scope of this challenge, because it's a lot of people who are homeless. It's a lot of people who are on the verge of being evicted. I think there are now more than 34,000 renter households and another 15,000 owner-occupied households who are severely cost burdened by the cost of housing here. Talk about the scope of this. I mean, it seems like a mountain too high to climb.
Well, remember the word that I mentioned to you earlier, intentional. We know, well, actually, I saw this morning that from January 2020, when the house prices were like 280, and September 2021, they were 381. So there's no way that we can build our way out of it. We keep saying it, but I think we can come up with innovative ways. We have buildings that are not being used by the county, the city, CMS, that can be used for innovative ways. We're talking about shared housing. I live in shared housing right now, so we have to come up with different tools, and those tools have to be accepted. Everybody's not going to be able to own a home, period. So we have to come up with different ways for people to live, period. I will never be able to own a home. The people who I advocate for, they will never be able to own a home, but everybody's pushing for home ownership. That's a great thing to push for it. But some people will not ever be in that position because it takes so long for them to be in that position. So we have to come up with innovative ways, shared housing, triplexes, duplexes, so different things like that. So,
Liz, like any other group, the homeless folks and those at risk of being homeless are not a monolith. They are as many different kinds of people in different situations as there are wealthy people. It's the same kind of thing. And I mentioned that 3,000 people were homeless on the streets last summer here. 10,000 were at risk of being evicted. The report also indicates that almost 4,000 students at CMS lack a fixed, adequate, and regular nighttime residence during the course of any academic year. Expand on that, because you're talking about the future there. If you're not in adequate housing as a student, you can't learn.
Yeah, well, I want to comment on your last question, then I'll go to that. I mean, we're coming out of this pandemic where we made really hard things happen. And I don't want to lose sight of all that this country and this community has done in the last 2 years. And so when we feel like things are intractable, I think we have to look around and remember the ways we've shown up and what's possible. And certainly bringing that sense of resolve to, child homelessness. I'm a mom. I know what it is to sit down and do homework every night. And I know what it's been like to go through, Zoom school over these last 2 years. And I just kept thinking, I cannot imagine doing this in a motel room. I can't imagine doing this doubled up in someone's house. I can't imagine doing this in a shelter. And we have some amazing parents out there who are faced with incredibly difficult circumstances and continue to show up with their kids, for their kids. We have resilient children, but as Stacy said earlier, we know we can do better, right? That's unacceptable. But I think, I believe everyone experiencing homelessness is worthy of that dignity and opportunity of housing. And so sometimes it's easier to find that sense of compassion when it comes to kids. We have an aging population of people experiencing this. We have more and more seniors, we have veterans, we have a wide variety of people, and every single one of them is worthy of the opportunity of housing.
This new report, and this new report, which includes solutions, is not the first initiative that Charlotte has embarked on toward homelessness, or focused on homelessness and affordable housing. In 2000, we had an initiative called Out of the Shadows. In 2006, More Than Shelter. In 2015, Housing First. And then the county's launch Upstream just 2 years ago, all with the goal of ending homelessness. We've passed several $50 million bond packages to grow and maintain the stock of affordable housing that we already have. The faith and the corporate communities have all stepped up and kicked in monetary contributions. And we have myriad nonprofits who are dedicated to helping folks who are homeless or at risk of losing their houses. If all of this has not worked in the past, Stacy, why will this one work? And I know James Lee said because this has intentionality attached to it, but tell me what that means in this context and why this program will work when the others haven't made a dent.
Well, I'll start with what James said, intentionality. I think this has been intentional with all the things that we looked at, but we're also
haven't all those plans been intentional? We didn't weave those plans and throw them out there because we wanted to feel like goody two shoes.
I think James wants to jump in.
Okay, James, go ahead.
Yeah, they didn't have the difference was these other plans did not have people like me saying the things that I've said to them, to Gene and Kathy, right? They've gone along with what happened. And so I'm an agitator, and I want people to have a place to live. That's the least that we can do in America. So,
well, James, give me an example of some of the things that you said that shook them.
Well,
Be
I mean,
honest.
talking to Gene and Kathy, when I talk about living in the dugout and living in a city where where there's so much opportunity, and here it is, we are in a sea of prosperity, and there's a lot of boats that have holes in them, and we have to plug those holes. And I think that once we begin to look at people, because I think they really saw me once they got to know me, right? A lot of times we don't know the folks who we serve. If we get a past that initial introduction and get to know people and know that they deserve this, right? I think that spurns us to more action. And I think that's what's making this different, because I see action happening, and I'm hoping that it will continue, right?
Liz.
I think what we're also, do you want me to go, Liz?
No, go ahead, Stacy. Go ahead. I'll come to Liz. Go ahead.
All right. I think what we're also seeing too is the framework is focused on system change, and it's not individual level. And that's one of the differences. We're also in a very different place when it comes to data in our community. We have a lot of lessons learned by understanding our flow into homelessness and our outflow out of homelessness, things that we didn't have at our fingertips before, we can use to help analyze what's going on here. And that provides a much stronger foundation when we're looking at developing the framework, and then when we look at developing an implementation plan.
Liz.
So Mike, I want to push back, I guess, on the premise of your question, which is these previous plans have been failures. And so I would ask, what would our community look like if we haven't taken the actions that we have taken through these previous plans? I mean, I think we're defined to say homelessness isn't over, so they haven't been successful. is for years, we made great progress reducing homelessness in our community when we really focused on housing as a solution. We've made, I mean, I did this work 20 years ago, and I would look around all these people who'd been homeless for 10 or 20 years. We've made huge progress on chronic homelessness and creating options. So there's more work to be done. I'm certainly not satisfied, but we can learn from those plans and continue to be even more effective in our action.
Well, the reason I asked the question that way is because everything I've read about this with regard to Charlotte and other cities is that over the last, well, since 2000, for instance, with all the efforts that I mentioned, things have not gotten better. They have gotten worse. And we are not alone. This is a national problem. LA Mayor Eric Garcetti was here, I think, in April of last year to talk about this issue and how his city has been handling it. And in Los Angeles, they have allotted $1 billion for homelessness. Much of the money coming into these programs in Los Angeles, here and around the country, is coming from federal aid. It's coming from tax dollars, either locally or federally. Isn't the real problem the lack of affordability of housing due to a lack of people being paid a living wage?
So I always
Liz.
say there's two ways you end homelessness, right? You can either increase your income to afford the housing that's out there, or you can find housing that meets your income. So kind of the general agreed upon goal is you shouldn't be paying more than 30% of your income on
Correct.
housing. So there's different ways to solve it. I mean, it's been unique to do this work in the last 2 years where folks that we're serving are able to have entry-level jobs at much higher wages than in the past. And in the same breath, we've seen rents rise, right? So it's like you make that progress and then the goalpost keeps moving. So it's really, to me, it comes back to that connection of what's your housing cost, what's your income. So absolutely connecting folks with career fields that allow for greater income is great. But what we're looking at is a system level issue of how incomes and housing correlate.
Stacey, we don't have an historian on this program, and everybody on here is relatively young and probably can't answer this question. But I'm going to ask you anyway, because when I was a kid, I was aware of poverty. I think there's always been poverty, and there always will be poverty in the world, but I was not aware of people literally sleeping on sidewalk grates or on park benches or in the woods or putting up tent cities around various municipalities. You never saw it, you never heard about it. Was it there and simply hiding in the shadows, or has something fundamentally changed about America?
I think that there's a few things. We have some of the unintended consequences of federal policy. So you think about the drug policies, you do drugs, you do hard time, all of those things. When people were incarcerated and coming back out into the community, they had additional barriers. So there are things that were put in place that were unintended as far as what it meant when people left another system, being the criminal justice system. Also, we've had a disinvestment in building public housing. We also have we don't have enough of the income-based rent subsidies for what people need. So there's a lot of policy level stuff that's occurred over time that you didn't see all of that before, but these unintended consequences create more barriers today than they did before.
But when we come back, let's talk about how this plan suggests we address some historical and structural inequities and some other suggestions for solutions to the problem that Charlotte and other cities in this country face. We'll do that when we come back. Charlotte Talks on WFAE. Support for Charlotte Talks comes from WFAE members and Heartwood Tree. Winter trees allow for more careful examination of tree structure. Heartwood Tree Services arborists can recommend long-term goals ahead of the spring thaw. Consultation at heartwoodtree.com. The backlash against Spotify and its podcast, The Joe Rogan Experience, is growing. Spotify's CEO says he doesn't want to get into the business of censorship. All of this comes amid Rogan's spread of misinformation regarding COVID-19 and his past use of the N-word. So where does Spotify draw the line in moderating content? They'll be talking about that in 20 minutes at 10 o'clock on 1A, and we will continue our conversation about our latest plan to combat homelessness in just a moment. Stay with us.
It's your world. We help you explore it.
It's a civil war that has gone on for years on the Arabian Peninsula in Yemen.
It's your community. We help you understand it.
The hurdles CMS has encountered in building a Latino principal pipeline illustrate bigger statewide issues. Governor Roy Cooper has urged the state to rally to get more educators of color into public schools.
WFAE's Morning Edition is an essential way to start your day and stay connected to your world. Weekday mornings from 5 to 9 on 90.7 WFAE.
It's Charlotte Talks on WFAE and WFHE. I'm Mike Collins. We're talking about homelessness in Charlotte, a new study with solutions, the 2025 Charlotte Mecklenburg Housing and Homelessness Strategic Framework. And we're talking about with three people who were part of the task force that developed this. Stacy Lowry, Director of Community Services for Mecklenburg County, James Lee, Affordable Housing Advocate at the Stan Greenspon Holocaust and Social Justice Education Center, and Liz Clayson Kelly, CEO of Roof Above. This is a 5-year plan. We've known about this issue for, I can't remember how long. As long as I've been here, 1985. Why will it take 5 years for this plan to be implemented, Liz?
I might not be the best person to ask that question. I mean, I think this is saying, what can we achieve in 5 years? I don't think, and Stacy, James, correct me, I don't think we're thinking, hey, in 5 years, there's not going to be a person experiencing a housing crisis. It's, as you said earlier, Mike, where we put an audacious vision out there and we're saying, let's take this at a chunk of time, 5 years, what progress can we make?
But why 5 years? I mean, we've known about this. Let's just say we've known about it since 2000. That's 22 years ago. We've watched the problem get worse. We know we don't have the proper tools to force developers to do this, and maybe we don't want them. We know we have this recurring problem. Why does it take 5 years to implement new ideas and solutions, James?
It's going to take that long because we're talking about helping to create the will to want to do it, right? Like we did with going to the moon. The nation, we willed ourselves to go to the moon. Everybody came together with the vision of going to the moon. This, to me, is our moonshot, right? The plan is our yellow brick road. But when we get to the castle where the wizard is, will we see that big face that's not there, or will we see the man playing with our lives with the thing in the back and punching the buttons? I'm hoping that at the end of this, that they're just going to tell us to click your heels 3 times and say there's no place like home, and then everybody has an opportunity. I think at the end of 5 years, I want to see us begin to show people an opportunity. We're not going to get there in 5 years, of course not, but I want to see change that will give people the hope that that we can make it.
I mean, we certainly, it's an admirable goal. It's one that must be worked toward unless we want things to become really untenable for more and more and more people. But in 5 years, this city, unless something horrible happens, is going to continue to grow. We're going to have more people coming here. We're going to have continually rising house prices because the housing market will be tight. And as fast as they're building these apartments, we can't build them fast enough to house everybody. And when they build them, they are luxury units and therefore unaffordable to many, many people. So nothing about that is going to stop in the next 5 years. Are we always going to be playing catch up, Stacy?
Well, Mike, that's a really good question. I think it's going to take time to be able to implement any kind of system change. And that's really what we're looking at. And that's why we look out 5 years to these audacious goals, is we're looking at system change, which has to happen incrementally. I think what's unique about what we have right now in time is the infusion of federal dollars that will be coming to communities, including ours, from the American Rescue Plan Act funding, which provides a new opportunity that we did not have before to really be strategic and use some of these recommendations to move us forward.
And who is administering that money? Because a lot of that money was available during the pandemic and much of it has yet to be distributed.
There are 2 rounds of funding regarding the CARES Act funding and then the ARPA funding. And my understanding is both Mecklenburg County, as well as the city of Charlotte and Charlotte Mecklenburg schools will all receive an allocation.
And I don't mean just in Charlotte, I mean around the country. Much of this money is sitting in bank accounts, God knows where, and it has not gone to the people who needed it the most at the time they needed it the most. This plan that we're talking about, James, outlines several priority areas. First among them is addressing historical and structural inequities. Within that category, there are items like putting racial justice and equity at the center of all the efforts that you're talking about, as well as reducing any stigma associated with affordable housing and removing barriers to access to that housing. Talk about those things. How do you think we can accomplish all of that? That's a pretty big serving.
And Mike, it is, because we have been dealing with this forever. The inequities of that we live in every day, that I live in every day as a Black man. Realizing that most people that are homeless are African American or a minority person or LGBT or someone with disabilities. 40% of the people that's on the street identify as somebody with a disability. And here is, it's going to be a tough thing. Like I said, it's like going to the moon. You know, when we went to the moon, it's just got to be so many things that we're going to have to agree upon. And one of the things we have to agree upon is where did we start with? Whose truth are we starting with? Right? Because your truth is different than my truth. And to get to a solution, right?
James, you just muted yourself.
A lot about truth in these meetings, right? Whose truth are we beginning the conversation with? And race, when you're talking about Black and white, it is a factor, and it will continue to be a factor until, you know, we get folks at the table to talk.
I am assuming, Stacy, that the people on this commission that put together this report and it suggested solutions like addressing historical and structural inequities, that all those people are on the same page. They see the problem, they acknowledge the problem. We have to solve that problem. Can it be done? Did they have any suggestions on how we do that? Because right now in this country, we are going through this conversation about how we look at our history. And there's a set of people who say, well, we historically discriminated against a whole set of people and we need to address that and fix it. While the other people are saying, now, wait a minute, don't encroach on my territory. That's your history. That's not my history. So how do we solve this problem?
I think what we've seen, especially over the last few years, is that racial justice and equity has been something that both the city of Charlotte, Mecklenburg County, as well as many other agencies and nonprofits are really looking at. And I think first and foremost, to James's point, is we're seeing individuals in our homelessness services that are primarily African American or Black. And being able to have the data to show that that is going on, and then being able to then address whatever barriers they have to access that housing. But part of it is also being honest with what the history was in Charlotte, Mecklenburg. Looking at what we've done in the past, the community through redlining and things like that, and acknowledging it occurred, and then using the data that we have to be able to start removing barriers to get people connected to the services and housing that they deserve.
So this report also talks about reducing any stigma associated with affordable housing. Is that the NIMBY idea that you can have affordable housing, but don't put it in my neighborhood, don't put it in my backyard, or is there some other component to that slug line there?
Yes, yeah, I didn't know who you're asking. So yes, I think that there is a stigma or a stereotype that people have when they hear the term affordable housing, and they don't want those people in their neighborhoods. And I think what we have is we have data that shows, not only in Charlotte, Mecklenburg, but across the United States, is that affordable housing isn't providing or creating problems in communities. And it's being able to really connect with people. I think what was unique about this situation that we had with the working group is we really got to hear about everyone's why. Everyone comes to this work and this problem and these solutions together with their own personal why. And James had shared what his was, but there were also people on the working group, including the people that you would think weren't as in touch with it, that also had a personal why. And I think people are really tapping into that to move us forward.
Another objective listed, James, is to, quote, increase access to landlords for individuals with challenging backgrounds to increase flow out of emergency response system. Good God, put that in English for me. What does that mean?
We need to have, we have coordinated entry, right? It's a great thing. We work with 211. We need to, like James Searcy says, we need to do a coordinated exit for folks while we work with landlords. And we have to get landlords who are willing to help us go to the moon, right? And not like be money hungry, whatever. But here again, that it has to be a combination of things put together. This is going to be some hard work to do, but the landlords and me being able to afford to live in Charlotte, it plays a big part in the sustainability of the success of my life and the people.
When they refer to these folks as people with challenging backgrounds, does that mean they are low income and have maybe not been able to make rent payments on a regular basis in the past, and therefore they have eviction records? Or are these people who are coming out of the criminal justice system who have arrest and jail records and they can't get housing, or both?
It's all kind of people. I mean, I work with a young lady, Judith, she supports those with disabilities. So, I mean, there's a ton of different reasons that why we should do this for the people that are in those situations, right? But I mean, we're still, I think everybody's just still searching for answers. You know, I don't have any answer.
Okay, Liz.
So, yeah, so I think in terms of challenging backgrounds, it could be criminal justice, it could be evictions, it could be low income. And James, I think you're right to say, giving people a shot at housing has a positive impact on the lives of people impacted. But I think it's really important to say addressing homelessness and giving people housing actually has a positive impact on all of us. So for example, if someone's been involved in the criminal justice system, one of the things we know is if they have stability, they're much less likely to return. It is in our best interest as a community that people have the stability of housing, and we need people who are going to give folks that opportunity and give them that shot. And that benefits not just the folks who would be moving into housing, but all of us.
So under this plan, one of the objectives for affordable housing are items like increasing the number of affordable housing units constructed or preserved, increasing the number of home ownership opportunities for households with income at less than or equal to 80% of annual median income, increase home ownership rates among Black, Indigenous, and persons of color. All admirable goals. Stacy, how?
How will we do that? I think part of that is the next stages with the implementation planning. We're going to get into the framework was kind of the overall encompassing what we are going to do and provide the structure. And really now is getting into the implementation planning of the how and what would it cost to fund it.
So that would be phase 2
Correct.
of this. And when do you embark on phase 2 of this?
Well, currently now we're looking at creating the enduring structure and identifying a quarterback agency to be able to take us through the implementation planning. So right now it's currently under development. So the hope would be that we should hopefully have an agency on board, hopefully by the summer.
So we've passed multiple $50 million affordable housing bonds. We have the communities, various different communities stepping up and putting corporate and faith charitable donations behind all of this. How much more money are we talking about, and where is this money going to come from? I know you're talking that that's going to be part of phase 2, but where do you think this money will come from? Anybody?
I think it can come from folks like the Foundation for the Carolinas, Center City Partners, these folks like this. I mean, we are a mega for Fortune 500 companies, right? You got Fortune 500 companies who have employees who are like one step away from homelessness. So it
Yes.
behooves them also to be a part of this, right?
Well, that gets us back to living wage. If the government, if the faith community, if charities, if tax dollars and are funding worthy causes like keeping people housed, and God knows that's a worthy cause, if we're doing that, what we're doing is subsidizing the wages of underpaid individuals. It's corporate welfare, isn't it?
but what's happening on the other side, right? When we give conglomerates, breaks to move into our community? What's the difference between that? I mean, that's,
No,
know,
it's, I'm on your side on this, James.
Yeah.
It's the same thing. We keep giving, we have people complaining about welfare for poor individuals, and yet we do all of these things
yeah,
for those individuals because they work. Some of these people work multiple jobs and
Yeah.
can't afford housing because they don't
Yeah.
make enough money.
yeah.
So Mike, I think wages are definitely part of that. And certainly, I mean, at our shelters for men, for example.
Well, Liz, you have titans of industry on this committee.
Yeah. So
in this
when you
community.
asked where.
Have they
well,
talked about, have they discussed wages?
So I think, I don't think we've got wages in the plan though, Stacy, you could speak to that. I think certainly the understanding, I think, of having them on the plan is that there'll be corporate investment in this plan. I think that's the expectation. Then there's different ways. I do just want to say, we do have people working. We also serve, we have an aging homeless population. And so we've got folks with disabilities. So it's not simply an income, though many people are working and we do need to address wages, but we've got to look holistically about housing.
So it's a 5-year plan, Stacy. In 2027, when this plan is unfurled, will there be a need to have this conversation again, or will the problem still exist? Do I have 10 seconds, 15 seconds?
Really quick. I think that we will see progress going forward, and the hope would be is that homelessness would be rare and brief and one time in our community, and that when someone has a housing crisis, they'll be able to get into shelter and then get out within 30 days.
Stacey Lowry gets the last word. Director of Community Services for Mecklenburg County. James Lee, Affordable Housing Advocate at the Stan Greenspan Holocaust and Social Justice Education Center, and Liz Clayson Kelly, the CEO of Roof Above. They're talking about the 2025 Charlotte Mecklenburg Housing and Homelessness Strategic Framework. Thanks for the hour.
Charlotte Talks with Mike Collins is a production of 90.7 WFAE. Support for Charlotte Talks comes from Mazda of South Charlotte. Our executive producer is Wendy Herkey.